Before we get into this article, I just want to tell you something that I was laughing about yesterday. I had pulled up a few articles on fentanyl, and I looked down in the comment section. Do you know the majority of the caucasoids in the comment section were saying they think this entire plague is a hoax? It's not really happening. It's a hoax. I said, that's good. That means that you're not going to be paying attention. And by the time you do pay attention, the damage will be already done. The damage is really done now, okay? Because they sure can't reverse it. But they're sitting around talking about it's a hoax. And it wasn't just one person. It was probably the majority of the people in the comment section saying this. They don't believe this is really happening. They believe it's a hoax. That's fine. It makes it that much sweeter when you fall. This article just came out on Stat News, June 27th, 2017. Stat forecasts opioids could kill nearly 500,000 Americans in the next decade. The rate they're going, I don't know. Do they even have a decade? Opioids could kill nearly 500,000 people across America over the next decade as the crisis of addiction and overdose accelerates. Deaths from opioids have been rising sharply for years, and the drug overdoses already kill more Americans under age 50 than anything else. StatActs leading public health experts at 10 universities to forecast the arc of the plague over the next decade. The consensus: it will get worse before it gets better. It ain't going to ever get better. There are now nearly 100 deaths a day from opioids, a swath of destruction that runs from Tony, New England suburbs on the farm country of California, from the beach towns of Florida to the Appalachian foothills. And the worst case scenario put forth by stat experts panel, that toll could spike to 250 deaths a day if potent synthetic opioids like fentanyl and carfentanil continues to spread rapidly, and the waits for treatment continues to stretch weeks in hard-hit states like West Virginia and New Hampshire. If that prediction proves accurate, the death toll over the next decade could top 650,000 people. Wow. That's almost as many Americans as will die from breast cancer and prostate cancer during that same time period. Put another way, opioids could kill nearly as many Americans in a decade as HIV/AIDS has killed since the plague began in the early 1980s. The deep cuts to Medicaid now being debated in Congress could add to the desperation by leaving millions of low-income adults without insurance, according to the nonpartisan Congressional Budget Office. Even the more middle-of-the-road forecast suggests that by 2027, the annual U.S. death toll from opioids alone will likely surpass the worst year of gun deaths on record, and may top the worst year of AIDS death at the peak of the epidemic in the 1990s, when nearly 50,000 people were dying each year. The death toll across 10 forecasts nearly 500,000 deaths over the next decade. Beyond the immeasurable pain to families, the overdoses will cost the U.S. economy hundreds of billions of dollars. See, this is why you're hearing about the article that I did before about the lawmakers saying, cut these people off. They're a drag on all of the resources, and they really are. All right, so this is their prediction chart. Wow. Okay. All right. A sort of interactive chart. All right. Okay. In addition to the forecast provided by academics who specialize um, in epidemics. So, what they're talking about is clinical medicine, health economics, and pharmaceutical use stats. Conducted more than 40 interviews with politicians and patient advocates, providers, and payers, doctors, and drug makers. This analysis is also informed by a review of presentations from top Trump administration health officials, including Health and Human Services Secretary Tom Price, National Institutes of Health Director Francis Collins, and the acting chiefs of the Office of National Drug Control Policy, the Substance Abuse and Mental Health Services Administration, and the Center for Disease Control and Prevention. It took us about 30 years to get into this mess. Robert Volek, professor at the University of Colorado Denver School of Pharmacy and Pharmaceutical Sciences, told Stat. I don't think we're going to get out of it in the next 2 or 3. I don't know what that. I don't think we're going to get out of it in the next 2 or 3. Oh, he's talking about decades. Okay. Woo. Okay. That's pretty bleak. If you think you're going to go a few more decades with this plague, it is not going to be anybody left. It's already so bad that once unthinkable scenes of public overdose are now common. People are dying on public buses and inside of fast food restaurants. They're collapsing unconscious on street corners and in libraries after overdosing on prescription pain pills, heroin, and fentanyl. A customer in Anchorage, Alaska, hit the floor on a subway while trying to order a sandwich. A mom in Lawrence, Massachusetts, sprawled in the toy aisle of the Family Dollar as her little girl screamed at her to wake up. A grandmother in Liverpool, Ohio, slumped in the front seat of an idling car, turning blue, while a toddler in dinosaur pajamas sat in the back seat. There are so many deaths. Some coroners are running out of room for bodies. The recent national statistics count more than 33,000 opioid-related deaths across the U.S. in 2015. Many victims are young, often in their 20s or 30s. Increasingly, many are white. But the plague touches, oh, they said the word plague, y'all. Woo! But the plague touches all demographics: farmers and musicians, lawyers and construction workers, stay at home moms, and homeless. I told you, they kept saying it was the uh, whites without education or the ones that had high school or less. But now you see it's clearly across all economic lines. So it's no longer just poor people and deaths of despair. It's hitting even lawyers and construction workers and all that. Okay. Most of the forecasts produced by STAT predict the annual death toll will increase by at least 35% between 2015 and 2027. Under the gravest scenario, it could triple to more than 93,000 deaths per year. Oh my God. These people, they ain't gonna make it, y'all. They are not gonna make it. On this, all experts agree fatal overdoses will not even begin to level off until sometime after 2020, because it will take time to see whether the federal government efforts to boost drug enforcement and push doctors to write fewer prescriptions for opioid pain pills are effective. It ain't going to work. If they can't get the pain pills from the doctor, they're going to go in the streets and get the heroin. We're already seeing that happen now. And plus, what are you going to do with China shipping all the fentanyl over here by mail that can't even be detected by dogs? Okay, they can't detect it at all, even with their best equipment. The worst case scenario is built around the assumption doctors will continue to freely prescribe and that people addicted to opioids will continue to be exposed, perhaps unknowingly, to powerful synthetic compounds like carfentanil and an elephant tranquilizer capable of killing a human with just a couple of grains. Okay. The best case projection has fatal overdose falling below 22,000 a year by 2027, but experts say reaching that level could require a major public investment in evidence-based treatment options and a concerted push among medical providers to control pain with non-narcotic therapies before trying prescription opioids. Right now, the US spends about 36 billion a year on addiction treatment, and just a fraction of those in need are getting better. Many of them don't. The vast majority of them don't. Okay, they can't kick their habit. It is really very difficult for them to do that. By contrast, federal officials estimate that opioid abuse drains nearly 80 billion a year from the American economy because of expenses tied to the healthcare, criminal justice, and loss of productivity. This is again why you're going to hear more and more of these politicians talking about letting these people go. Okay, like I said before, not unless they got a bottomless pit of money that we don't know about. That's a lot of money to go through every year. 80 billion, we're already up to 51 billion a year. So if they're estimating it can go up to 80 billion a year, these people dragging down the economy by that kind of money, whew. Hey y'all, if we do our boycott on top of that, America's gone. Think of something, black people. Think of something. President Trump, who has vowed to make opioids a priority, has appointed a commission led by New Jersey Governor Chris Christie to explore solutions, but it hasn't yet laid out its idea. And in the meantime, the administration proposed budget would slash most domestic spending, which health advocates call profoundly counterproductive. Are we doing enough of what we think works? Prescription drug monitoring programs, medication assisted treatment, naloxone, asks Dr. Ronald Burke, Dean of the University of Pittsburgh Graduate School of Public Health. And Burke said, are we matching the socialite costs with like expenditures in prevention? So, I mean, they're hoping to get the deaths down, but right now I can tell you, I really don't think it happened. It's going to happen because the more a drug addict can't get a hold of the opioid pills, they just going to go out to the street drug. I mean, you're only talking about stopping it at the doctor level. I mean, you're not talking about stopping it at the street level, which is impossible. America has never stopped drugs from coming in. So what if you close it off at the doctor's level? If you still got all the drugs on the street, how is that going to put a dent in anything? I'm just saying. The Stats Analysis Project, many painful years ahead, the roots of the crisis through stretch back generations to the 80s, when pharmaceutical firms first marketed prescription opioids like oxycodone and hydrocodone to treat pain and claimed they carried minimal risk for addiction. Over the years, these companies pushed hard to get pills in patients' hands with strategies that included paying middlemen to circumvent state regulations and allegedly bribing doctors to prescribe opioids. The results are staggering. Opioid prescriptions nearly tripled between 1991 and 2011. It has been abundantly clear in recent years that such prescriptions can be dangerous. From 2005 to 2014, the rate of opioid-related emergency department visits nearly doubled, according to a new report from the Agency for Healthcare Research and Quality. Yet, recently in 2015, doctors prescribed prescription painkillers to more than a third of American adults, despite limited upsides for many patients. It's like cigarettes in the 50s. Look, we look back at the way people smoked and promoted cigarettes as laughably backwards. Magazine ads with doctors saying physicians prefer Camels. Dr. Michael Bennett, assistant professor of health policy and management of Harvard University, said, "We have the same thing now. Oxycontin ads in medical journals where doctors say opioids are good for treating pain. They don't have addictive potential. It's possible 20 years from now, we're going to look back, and I cannot believe we promoted these dangerous, addictive medications that are only marginal, more effective." Shoot, 20 years from now, you may have a whole new drug out there. They come out with these new drugs all the time. The state of Ohio, among a handful of governments currently suing drug makers, allege that a well-funded marketing scheme led to its residents receiving 3.8 billion opioid pills from 2011 to 2015, fueling human tragedy of epic proportion. Fatal drug overdoses in Ohio have soared by 642%. Wow. Wow. Since the turn of the millennium. Another statistic: the number of privately insured patients diagnosed with opioid dependence increased nearly six-fold in just 5 years, according to data compiled by Amino, a healthcare data analytic company. Um, in 2012, only 241,000 such patients had an opioid dependency diagnosis. By 2016, that number was 1.4 million. And those numbers don't account for the hundreds of thousands more battling addiction while on Medicaid or Medicare, or while uninsured. Wow. The surging death toll affecting growing numbers of white Americans sparked demand for action in ways unseen during past epidemics that disproportionately affected minority populations. Duh, I wonder why. Law enforcement officers started shutting down pain clinics known as pill mills, where doctors accepted cash for painkiller prescriptions. But that only accelerated demand for heroin, as pill mill patients had trouble finding treatment to break free from their addiction. Desperate to keep feeding their cravings and avoiding the anguish of withdrawal, people from all walks of life, soccer moms in Vermont, C-suite executives in California, college-bound kids in West Virginia began to shift from prescription pills to heroin, which was more potent and had become far cheaper thanks to heightened drug trafficking into the U.S. by cartels. 2 years ago, heroin deaths surpassed the toll from prescription opioids for a first time this millennium, according to the Washington Post. 30 years ago, the heroin dealers drove through Arkansas on their way to more populous and lucrative markets. Dr. G.R. Richard Smith, professor of psychiatry, medicine, and public health at the University of Arkansas for medicine, medical science, told Stats. That's not the case now. People are switching from legal prescription meds, rightly or wrongly prescribed, to heroin. Yeah, because that's what's going to happen. I mean, they keep talking about stopping the doctors from writing so many scripts, but what they're leaving out is, what about the street drug? If they can access the street drug, how is that going to slow them down? It's not. And they have no incentive of getting off of these drugs when you're coddling them and saying it's a public health issue. If I was an addict and you kept patting me on the head saying it's a public health issue and allowing me to stay on the streets to get the drugs, why should I get off of them? These people are really silly. Let me see what it says towards the end. Okay, so what I'm going to do, I'm going to leave this link in the description box, and you can go out here and access this article and read through it. And it's just going over like certain towns and how many overdoses that they have, and 911 dispatches and things like that. So, and we all generally know that, that's the case from my previous articles on opioids. So it's not getting better. So now they're talking about the death tolls are nearly 100 per day. So it's not getting better, y'all. It's getting worse. And to be honest with you, I don't care how much they keep holding back on the scripts. These people are going to find a way to get to some type of alternative drug. It's just going to make fentanyl and the carfentanil more popular. And of course, the heroin. Please leave your comments and subscribe. And if you can donate to this channel, please do. And I also want to say thank you for all of you that have become patrons and also given donations on GoFundMe. Your help is deeply appreciated, and you just can't imagine how much I love and appreciate each one of you that have helped out. Peace, family.